Good morning. I hope everybody can hear me okay. My name is Rosa. For those of you that don't know me, I am an LPN here at Two Rivers Public Health Department. Happy Valentine's Day to everyone. These are the counties that we serve. We serve 7 counties. And oh, there's my screen there. There we go. Sorry about that. This is a census basically in all of our counties. Buffalo County, 50,114, Dawson, 23,510, Phelps, 9,000, Kearney, 6,652, Harlan County, 3,311, and Franklin, 2,940. There's 1,986 in Gosford. And I thought this was an interesting fact, so I thought I'd share it with you all. The towns that we serve in Buffalo County, there's 16, and Dawson, there's 10, and in Franklin, there's 8, Gosford, there's 4, Harlan, there is 8, in Kearney, there's 5, and at Phelps, there's 8, and there's a total of 59. So we are very busy. A few of the things that we do at Two Rivers, before I came with Two Rivers, I really didn't realize how much they do, but we do a lot. So we do, amongst that, we do disease surveillance, chronic disease prevention. We do have Life Smiles dental program, which actually is mobile because they go to different towns in our jurisdiction. We also do lead exposure cases, West Nile virus cases, STIs, emergency response. We do collaboratives, also Vibrio, rabies, Lyme disease, hepatitis A, B, C, D, and E. I am your local TV nurse for our jurisdiction, and also we do Shigella cases, and this is just to name a few. Our mission here at Two Rivers, so Two Rivers Public Health Department engages collaborative partners, community leaders, and the public to promote healthy lifestyles, provide and prevent education, preventative education, also assure environmental quality, and to create more healthy and safe communities for all who live within our jurisdiction. And our mission at Two Rivers is to health districts, we all are able to safely and actively live, learn, work, and play in our communities. So basically, our job is to maintain health in our community. If you go to your doctor is specifically emphasizing in you, your family, whoever they are seeing at the moment. But we don't only take care of you, but we take care of you, your family, your neighbors, everybody in our jurisdiction. These are our awesome nurses. So our nursing team, our fearless leader is Jackie Haley, and she is an RN. And then we have Jordan, who joined our team, and we are so happy to have her. And she's also an RN. We have below her, we have Liz, and she's also an RN, a lot of cardiac experience there, and great team member of ours. And then I am here in the upper right corner, and then below me is Miss Rita, RN, who also has a lot of experience, and also Marilyn below here, who's an LPN program nurse. So all of our nursing team is pretty awesome. We all have, I'd say, over 100 years of nursing experience altogether. We all have different experience in different
I can't
areas. So that is awesome. It just makes a great team.
I have nothing to do it.
And this is
On hers, this would record on my computer.
So this is a map of the Health and Human Services region. We are here located in the middle, and we are region 7. So 7 of 10 HHS regions are below their outpatient respiratory illness baseline.
Weird, okay.
I feel like
So the national flu activity. So I do want to point out some interesting information here. It's not very, it's not very good news, but there have been an increase in flu deaths, which when we were masking because of COVID and all that, it was very minimal. And now it seems with all the masks off and everything, a lot of that leaves us at risk for a lot of respiratory issues. So CDC continues to recommend that everyone aged 7 months and older get an annual flu vaccine as long as flu activity continues. 9 influenza-associated pediatric deaths occurred during 2022 to 23 season. That was reported this week. Also for a total of 106 pediatric flu deaths reported so far this season, which is not good. It's kind of hard. I know some kids were really good at wearing the masks because they had, Spider-Man and Wonder Woman or what have you on it. But I still would recommend that if you are going to Walmart or you're going to a place that there is a lot of people, please, it's your discretion, but protect your children as much as you can, protect yourself. So that's still our recommendation. Influenza-associated pediatric deaths. So here is the graph that can show you what we were just discussing. At 2019 to 2020, number of deaths 199. 2020 to 2021, number of deaths 1. That's a big difference. And then 2021 to 2022, number of deaths 45, and 2022 to 2023, 106. So as we can see by our graph, and you can see below to the week of death here, there was like periods where there was none, and that's awesome. So my heart goes out to those who have lost children because of flu. It's very, very preventable. And so just do the best we can to emphasize the importance of that. Prevention is always key. COVID by the numbers is update as of February 13 of 2023. So as of February the 9th, there are 91 county districts in our territory with a high COVID-19 community level, 715, with a medium community level, 2,407 with low community level. Compared with last week, the amount of COVID is decreased throughout the United States. So states that have low community levels, in the entire state. And this really surprised me. So I'm sure it'll surprise you. Arizona, the District of Columbia, Hawaii, New Hampshire, and Utah, which is not what I expected because I think they have a huge population, but good for them. So COVID case rates are still really low, but have increased week to week over the last month. 13 positive cases were reported the week of January the 15th, and 34 cases were reported the week of January 22nd, 74 cases the week of January 29th, and 84 cases last week. We can see that by this graph here on my left-hand side where we have the orange and little more kind of color going on there. So there's still much lower than case rates from last year, but we just want to do the best we can. The district daily case rate per 100,000 is 12.8. So we have from 12 to 13 COVID cases reported each day at this time. So it's still out there. I did want to throw in some cardiac information for you all because it is Valentine's, so it has to do with the heart. So these are a few simple ways, 1, 2, 3, and 4 here on my left-hand side here. It says your heart, 4 ways to protect it now. So eat like the Mediterraneans, get active, watch your weight, which is kind of hard for us all with the cold weather and all, but you can also stand in place and as you are watching TV, your favorite show, Netflix, whatever, and also know your family history. That's not something that a lot of people know because it's not like you all sit down at the dinner table and say, so grandma has diabetes and Hilda has, you know, hypertension. But it's very important that you know at least your mother, father's medical history, and also brothers and sisters and stuff like that. So here is the heart health numbers that you should know also here on this right side. So 1, 2, 3, 4, 5, and 6. So your resting heart rate, LDL, I know it's a little confusing sometimes when you go to the doctor and they check your lipids. So LDL is your bad cholesterol. And then below that we have the systolic blood pressure and then waist circumference, hemoglobin A1C and your A1C and body mass index. So I know that it's really hard, at least for me, because I'm Latino and we do not eat healthy, even though our food is very good, but a lot of diabetes runs in our family. So we want to have an A1C below 6. So it's very important that you speak to your provider if you feel, if your culture or your family intakes high calorie, high fat intake of foods so that we make sure that your A1C is low so that you don't have any cardiac issues. I wanted to share also some very important information. I know that a lot of us work, so sometimes we have, we need babysitters to kind of help out so that we can go about our day and working. So I think this is a really great thing to know. So CPR saves lives. Here's your ABCs, airway, breathing, and circulation. And on the right, you can see step 1, 2, 3, and 4 for CPR for adults. And Erica Carpenter, welcome to our team. She is our Two Rivers Emergency Response Coordinator, and she does do CPR classes. And we will be sharing with you guys in the future whenever she has dates as to availability and stuff like that. So we continue to try to do what we can for our community in our jurisdiction. And also you can contact the local CCC and they can tell you whenever they're having classes so that if you have a teenage daughter or son who is babysitting your younger kids or a local neighborhood babysitter, then it's like very, very important that they have CPR so they can make sure and they are available in case something happens to your children. Upcoming clinics. So we are still doing vaccine clinics, I know, believe it or not, at the Buffalo County Fairgrounds, Holdridge Physical Therapy, Holdridge Auditorium, and also here in our office and also in COZAD. We are also, so here is our calendar and you can go to the link here and see when we are going to be going closer to where you live so that you don't have to, so it's not inconvenient for you and your family. But here's our calendar and feel free also to give us a call and we can also help you out if you're having issues trying to see our calendar. And we are Two Rivers Public Health Department here to serve all of our jurisdiction. Again, our goal is to make sure that everybody is healthy. Here is our phone number and here is our email, so our website. So if you guys have any questions, feel free to ask now. No questions or comments? Okay, well, everybody have a good day and happy Thanksgiving to you all, and make sure you take care of your heart. Thank you.